Good afternoon. So welcome to Wednesday Reading Live. My name is Vandana PS, one of the reading trainers from 𝐂𝐴𝐴 Academy. So as usual, shall we do a sample question from part B? Are you guys ready? Okay. So I'll give you 2 minutes for the completion of this question. So please do this question, then we will discuss the answer. Okay. So once again, good afternoon. Hi Shaini, Neetu, Anju. Good afternoon, guys. Have you all done this question? Okay. And I think this question is a little bit tricky when you compare with other sort of questions. So I'll read the question, then we will discuss. All right. And the question is like, in the prospectus for infection prevention, what are control professionals required to do? Okay, so what are the keywords here? Let me know in the comment box, please. What are the keywords from this particular question? So what are the keywords? Let me know in the comment box. What are the keywords from the question? Yes. So what are the keywords here? Which are control professionals required. Okay, so these are my keywords. And if you want, you can mark as well as prospectus. Okay, then control, then required. So these are my keywords from the question. Or otherwise, if you want to mark like infection or prevention, then required. So likewise, only 3 keywords required here. Okay, and before that, anyone is attending my class for the first time? ആദ്യമായിട്ട് live attend ചെയ്യുന്ന ആരെങ്കിലും ഉണ്ടോ? Let me know. Hi Vinod, yes, Rose, Anish. Okay. So what are the keywords here? Prospectus, control, required. Okay. And in which category the question is from? So part B is all about 3 different categories. And as you know, the first category, which is a guideline. Okay, is it a guideline? Is it a guideline or no? No. Then second category, manual or policy. Is it a manual or a policy? Then the final one, which is email, then memo or notices. So let me know in the comment box in which category the question falls under. The category of question ആണ്. Prospectus ആണ്, and it is not mentioned in the question which category of question. So majority of the time in part B, definitely they will mention the category in the question. But here, in the heading also as well as in the question, they have not mentioned the category. So let me know in the comment box. Yeah, what category of question? Hi Krishna, yes Asha, Lakshmi, good afternoon. Okay, so this is a prospectus and it is all about the infection prevention. So we can take it as a notice. Okay, and this is a notice for control professionals. They should do something, required to do something. So what is it? I'll read the options. So option A, prepare an exhaustive analysis and control an outbreak. Option B, chart a course to apply policies that cuts an infection. And option C, implement practices that are best suited for individuals. So these are my keywords. I'll mark the keywords. I'll mark the keywords from here. So what are the keywords here? Prepare, exhaustive, and control. So these are my keywords. And from option B, my keywords are course, policies, infection, and option C, implement practices, individuals. Okay. So yes, Purnima, it is a notice. Very good, Purnima. Yes, dear. Okay, Gopika, this is from the third category. Very good, Gopika. Hi, Rinu. Yes, Asha, this is from notice category. Yes, third category, this is a notice because this is not an email, not a memo because there is no sender, no receiver. All right, so this is from the final one, which is a notice. And what are you reading for in a notice? എന്തിനു വേണ്ടിയാണ് നമ്മൾ usually ഒരു notice വായിക്കുന്നത്? To get a particular information regarding something. Okay, and we are reading for the purpose. So what is the purpose here? What is the overall idea? I'll read the paragraph. Infection prevention and control professional, a person whose primary training is either nursing, medical technology, microbiology or epidemiology, and who has acquired specialized training in infection control. Responsibilities may include, so what do you mean by responsibility? This is my responsibility to take these classes. That means, ഇത് ഞാൻ ചെയ്യേണ്ട കാര്യങ്ങളാണ്. Okay, this is my responsibility, which means this is something I require to do. This is I should do. So here, question is always about control professionals required to do. That means they should do something. That means it is their responsibility. Okay. So responsibilities may include. So what are the responsibilities it comprise here? Collection, analysis, feedback at IRS group, infection data and trends to healthcare providers, consultation of infection risk assessment, prevention and control strategies, performance of education and training activities, implementation of evidence-based infection control practices, then those mandated by regulatory and licensing agencies, application of epidemiologic principles to improve patient outcomes, and this is a set of responsibilities that they should do. ഇവർ ചെയ്യേണ്ട അല്ലെങ്കിൽ ഇവർ പ്രിപ്പയർ ചെയ്യേണ്ട ഒരു സെറ്റ് ഓഫ് കാര്യങ്ങളാണ് പറഞ്ഞിരിക്കുന്നത്. Okay, and you can see that there is no full stop in between the lines. ഒരു ഫുൾ സ്റ്റോപ്പ് പോലും ഇതിൻ്റെ ഉള്ളിൽ മെൻഷൻ ചെയ്തിട്ടില്ല. ദാറ്റ് മീൻസ് എവറിഥിങ് ഇസ് എൻഡിങ് വിത്ത് എ സെമി കോളൻ ഹിയർ. ദാറ്റ് മീൻസ് ഇറ്റ് ഇസ് കണ്ടിന്യൂയിങ് ത്രൂ ഔട്ട്. ഓക്കെ, സോ ദെൻ റെസ്റ്റ്. Participation in planning renovation and construction projects, evaluation of new products or procedures on patients' outcomes, oversight of employee health services related to infection prevention, implementation of preparedness plans, communication within the healthcare setting, with the local and state health departments, and with the community at large concerning infection control issues and participation in research. Okay, so that's all about the responsibilities they should do. So any idea which is the correct answer here? Let me know in the comment box because you guys have already done this question, right? So what is the answer? Yes, Rose and Gopika, we are reading for the purpose. Hi Mithun, good afternoon, how are you? Yes, yeah. So what is your answer? Let me know in the comment box what is the correct answer and let me know how you eliminated other options. For example, if option C is your answer, then tell me how you guys eliminated A and B. Okay. All right, Rose, your answer is option C, right? Okay. Then from which line you got an answer? എന്തുകൊണ്ടാണ് option C select ചെയ്തത്? Okay, Amy, Gopika, option C. So why? Why option C? Majority, I think it's option C, right? Any other answers? Any other answers other than option C? Okay, Rashmi, option C. Why? Option C. Why? Any reasons why you guys have selected option C? Then tell me why you eliminated A and B. So the strategy which we are following here, which is elimination method or elimination strategy, അല്ലേ? അപ്പോൾ നമ്മൾ എങ്ങനെയാണ് ഓപ്ഷൻസ് എലിമിനേറ്റ് ചെയ്യുന്നത്? How can we eliminate or delete the options, discarding the options? Okay. Hi Anju, good afternoon. Okay, Asha, C in the last line of the paragraph. Okay. Okay, now I got your trick that. Okay, so you guys have selected option C because I understood. Because I've told you if it is a notice or something, then answer will be in the last line, right? I haven't said that. Answer will be in the last line. Last lines are important, that is what I said. ഒരിക്കലും ഞാൻ പറഞ്ഞിട്ടില്ല ലാസ്റ്റ് ലൈൻസ് ആൻസർ ആണെന്ന്. Last lines are important, that's it. Okay, so is it option C from the last line? No. Answer is not option C. It's not option C. Best suited for individuals, I agree. See, implementation of preparedness plans, communication within healthcare setting, local and state health departments. So, see, just imagine, with your common sense, you can imagine what is the purpose, which means purpose nu parna enda an overall idea. So ഇവിടെ implementation preparedness plans ആണോ overall idea? Is that the overall idea? No. So what is the overall idea here? What is the purpose here? എന്താണ് ഇവിടെ purpose എന്ന് പറഞ്ഞാൽ? What is the overall idea? What is this notice talking about? എന്തിനെ പറ്റി അവർ പറഞ്ഞുകൊണ്ടിരിക്കുന്നത്? That is option A, prepare an exhaustive analysis and control an outbreak. So where is it mentioned? എവിടെയാണ് മെൻഷൻ ചെയ്തിരിക്കുന്നത്? It is mentioned from second line till the last line. It is paraphrased. Okay, because prepare an exhaustive, which means something, it includes everything, a lot of factors. But exhaustive analysis endana? What are the responsibilities? Oru karyamaano? It's not a single thing, a lot of factors. So that means exhaustive analysis and control an outbreak. So why they are doing these responsibilities? To control the outbreak, right? So answer is option A. Prepare an exhaustive analysis and control an outbreak. That is the correct answer. How can we eliminate option B as well as option C? Okay. Option A, chart a course to apply policies that cuts an infection. Okay. I'm eliminating option B. This is not my answer. Why? Is it a course? ഇതൊരു course ആണോ? This is not a course. ഇത്രയും കാര്യങ്ങൾ കൊടുത്തിരിക്കുന്നത്, this is not a course. And these are responsibilities they should do. Ano? So eliminate option B, contradictory or opposite option. What about option C? It is mentioned here. Alle? It is mentioned in the last lines. Implementation of different practices, അല്ലെങ്കിൽ plans ആണ് പറയുന്നത്. It is mentioned. Why I am eliminating option C? Okay, so why? Because it is, എന്തുകൊണ്ട് eliminate ചെയ്യുന്നത്? Again, contradictory option or opposite option to the question, because practices, these are not in the purpose of the notice. It is the overall idea, which means exhaustive analysis prepared by the control professionals. Okay, so that is the correct answer. Okay. Hi Sajna, how are you? Okay, Shiny, the one you explained yesterday regarding part A, can you repeat again, please? If when, where, why, what, which, etc. comes in the question, what we need to focus while answering, my special request. All right. Okay, dear. Yes, outbreak. Okay, Sonia. Yeah, A is the correct answer. Okay, Rose and Asha, very good guys. Your answer is correct, which is option A. Okay, and very quickly I'll give you just a condensed form of part B today. In part B, we have 6 questions. Please listen properly, okay? We have 6 questions in part B, and the type of questions which are multiple choice questions with 3 answer options. As you can see here, there is a question, 3 answer options and a paragraph. Okay, so multiple choice questions with 3 answer options. And what are the chances of options? നമുക്ക് എങ്ങനെയൊക്കെ eliminate ചെയ്യാം? One option will be definitely, it will be the correct answer, you know. And remaining 2 options, one will be not mentioned option and one will be opposite option or contradictory option. Okay, and I'll give you simple 5 steps to do part B. Okay, so the first step, read the question വായിക്കുക. Second step, underline the keywords from the question the keywords underlines here. Third step, understand the question. You should understand whether this question is from which category, ഏത് category ആണ്, what are you reading for, which lines are important. Then fourth step, read the options, underline the keywords from the options and read the paragraph. So fourth one is all about reading. The last one is elimination. And the most important thing is, when you read the paragraph itself, along with reading, you should eliminate your answers. നിങ്ങൾ ഓപ്ഷൻസ് എലിമിനേറ്റ് ചെയ്ത് പോവുക. Okay, along with reading. And finally, you will get a correct answer. So that's all about part B. So now we are moving to the very next topic. Yes, so we have a new material here regarding part A. So as Shiny requested, okay, I'll explain about part A. Okay, so what do you guys know about part A? Let me know in the comment box. നിങ്ങൾക്ക് എന്തൊക്കെ അറിയാം? എന്തൊക്കെ കാര്യങ്ങൾ നിങ്ങൾക്ക് അറിയാം regarding the time, what method we are using, what is the strategy, then how many questions will be there, how many text will be there. Let me know in the comment box, please. എത്ര മിനിറ്റ് ആണ് പാർട്ട് എ, എത്ര ക്വസ്റ്റ്യൻസ് ഉണ്ട്, എന്ത് സ്ട്രാറ്റജിയാണ് യൂസ് ചെയ്യുന്നത്, എത്ര ടെക്സ്റ്റ് ഉണ്ടാവും. സോ പ്ലീസ് കമൻറ്റ്. Okay, Ezekiel, yes, skimming and scanning, it is the method. All right. Yeah. Then 20 questions will be there. Okay. Okay, Amy, 20 questions. Yes, Rose, 20 questions complete in 15 minutes. Very good. Okay, Ezekiel, 15 minutes. Okay, Alina, skimming and scanning. Okay, Sheena, 15 minutes. Yes, Vinod, 15 minutes. Okay. 13 tricks, which means? Okay, what do you make 13 tricks? 15 minutes, 20 questions. Yes, Amy, part A, 15 minutes. Yeah. Okay, Alina, 4 parts. It's not 4 parts, dear, 4 texts. Okay. Yeah. So I'll just summarize regarding part A. In part A, we have 4 different texts. നമുക്ക് 4 different texts ആണുള്ളത്. Text A, text B, text C and text D. Okay. Clear? 4 text. As you can see here, kando, text A, B, C and text D. Okay? And the time is all about 15 minutes. 15 minutes. Out of 1 hour, we will get 15 minutes for the completion of part A. And within this 50 minutes, you should complete 20 questions. So what is the total number of questions? 20. Okay, 20 questions. And these 20 questions they have categorized into എത്ര sessions ആയിട്ടാണ്? 3 different categories. 1 to 7 set of questions can be called match the following questions. Clear? Match the following. That means you can read the question, underline the keywords from the question, identify from which text you got the answer. ഏത് text ആണ് എന്നുള്ളത് മാർക്ക് ചെയ്യുക. Okay. That is 1 to 7 set of questions. If the answer is from text A, you can mark it as A. If it is from C, you can mark C. Then 8 to 14 set of questions. അതിന് എന്താ പറയുക? Short answer questions. Okay, so if you guys are doing any old material or something, definitely you can see that variations in the question pattern. ചിലപ്പോൾ നിങ്ങൾ നോക്കുമ്പോൾ 1 to 6 ആയിരിക്കും, or 8 to 15, or 8 to 13. So likewise, there will be changes, but the standard categorization is 1 to 7, 8 to 14, 15 to 20. Okay, and in 8 to 14 set of questions, ഞാൻ പറഞ്ഞു, it is short answer questions. അവിടെ നമ്മൾ എന്താ ചെയ്യണ്ടേ? Read the question, underline the keywords, find out from which text, then find out where is the answer mentioned, write down the answer here. And when you write down the answer here, please make sure that it is not more than 3 words. Okay, 3 words കൂടുന്നില്ല എന്നുള്ളത് make sure ചെയ്യുക. So 3 words when I say 3 single words or 3 separate words. Okay, because very clearly you can answer it in a word or a short phrase. So which means maximum 2 to 3 words. Okay, that is the important instruction provided here. Then coming to the question answers, when you do short answer questions in part, the second set of category, 8 to 14 set of questions, you can see a lot of WH questions here, as Shiny mentioned. Okay, what, when, why, how many, how much, where, okay, which. So likewise, a lot of WH questions will be there in this particular, short answer questions. Okay, now the questions are answer. For example, if a question is starting with when is starting, for example, and what is the meaning of the question? For example, as I mentioned in the previous class, when it was introduced. This is introduced. That's a question. When it was introduced. And the answer mentioned in the paragraph is, it was introduced in 2024. Okay, the answer is, it was introduced, please listen carefully, it was introduced in 2024. So what will be your answer? എന്തായിരിക്കും നിങ്ങളുടെ answer? I'll repeat. Question is, when it was introduced. And the answer mentioned is, it was introduced in 2024. So let me know your answer. എന്തായിരിക്കും നമ്മുടെ answer? ഒന്ന് കമൻറ്റ് ചെയ്തേ. What is your answer? When it was introduced. And the answer mentioned is, it was introduced in 2024. Yes. Okay, Asha, Jissa, only 2 answers. Okay, Shiny, Amy. Okay, any other answers? Okay, Renu. Yes, Alina, Lakshmi. Okay. Actually, answer is in 2024. Why? Why it is not 2024? Why it is in 2024? Answer in 2024 ആണ്. എന്തുകൊണ്ടാണ്? Because question is not about what is the year. ഏത് വർഷമാണെന്നാണോ question? അല്ല. In which year? No. Question is when. എപ്പോഴാണ്? Time. So they need the time. So answer is in 2024. So that preposition is important there. In, after, before. Okay, so preposition is always important when you answer short answer question which is starting with when. I hope it is clear. Okay, second one. If the question is starting with where, W-H-E-R-E, where. Again, same strategy, we need to answer it with the preposition mentioned there. Okay, under the table, above the table, below the table, beside the table. So where is the exact position? So that is where. Evideyan. Okay, so that is when and where set of questions. And if you guys are answering to the questions like how many children will be there, how much is the price? So when you answer these type of questions, how many or how much, and we need to answer it in a very single figure. That means the number is needed. Or a number madhi avada. 50, 200, 3. So likewise, only the figures needed. Don't write more than 50, less than 50, greater than, equal to. They just need a number. Okay. If the question is about which, what, why, then you can say, okay, maybe more than, greater than. But if it is how much or how many, then we need a figure. Or a number matramadi, that means 200. Or 3, 30, 40. Okay. That's it. Yes, only a numeric is needed. Okay. Yes, so that's it. Clear? I hope it is clear for you. And once again, I'm repeating, when you answer short answer questions, don't write more than 3 individual words. Okay, that's it. And if abbreviations is mentioned, you can write the abbreviation, of course. Short answers idea madi kata. Okay. Then final one, 15 to 20, which is edana, fill in the blanks. Okay, fill in the blanks enganeyana, when you read a sentence and something is missing there, endakyo missing aanu, you need to fill it. Very simple. Okay, again in a word or a short phrase. That's all about that. I hope it is clear, right, Shiny? Any other doubts? Okay, most welcome, dear. Okay, so we are moving to this new topic. It is bruxism. Even though the spelling is BRU, we are reading it as O, bruxism. Okay, so yes, so I'm directly moving to the questions. Okay, first one, link between sleep apnea and teeth grinding. So my keywords, link, sleep apnea and grinding. Let me know in the comment box, please, what is your answer or what are the answers? എന്തൊക്കെയാണ് ആൻസേഴ്സ് ഒന്ന് മെൻഷൻ ചെയ്തേ. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, ലിങ്ക് ബിറ്റ്വീൻ സ്ലീപ്പ് അപ്നിയ ആൻഡ് ടീത്ത് grinding. Where is it mentioned? You know that 1 to 7 set of questions we need to answer which text. Alle? Yeah. So where is the text? Which text? Let me know. Yes, new students. Okay, Krishna. Okay, Krishna. Yes, Shiny, Asha, Krishna, Libby. Any other answers? Okay, so the text is very good. It is from text B. And where is it mentioned in text B? ഞാൻ പറഞ്ഞു എൻ്റെ keywords എന്തൊക്കെയായിരുന്നു? Sleep apnea, teeth grinding. What is the connection with sleep apnea and teeth grinding? As you can see here, which is mentioned in text B. Ano? Yes. Sleep apnea. Research has confirmed a correlation between, that means a link between sleep apnea and teeth grinding. Kanda? See? And where is it mentioned? B. So answer is B. Clear? Okay. Yes, Alfie. Yes, Ezekiel. Very good, dear. It is from the last bullet point. Yes, Krishna, Asha, Libby. Very good. Second one. Presence of which medical condition would make someone prone to bruxism? So my keywords, presence, medical and prone. Yeah. Little bit lengthy, but yeah. So what is the correct answer here? Presence of which medical condition would make someone prone to bruxism? Yes. Okay, Libby. Is it from C? Sure. Or no? Presence of which medical condition would make someone prone to bruxism? If it is from C, then tell me where is it mentioned? എവിടെ മെൻഷൻ ചെയ്തേക്കുന്നത്? സിയിൽ. യെസ്, ശോഭന, കൃഷ്ണ. എവിടെയാണ് സിയിൽ മെൻഷൻ ചെയ്തേക്കുന്നത്? സി സംടൈംസ്, വേറൊരു ക്ലൂ ഞാൻ തരാം. സംടൈംസ് ദ സെയിം answers will be mentioned maybe in two different text. So എവിടെയാണോ ഫസ്റ്റ് മെൻഷൻ ചെയ്തേക്കുന്നത്, in which text it is mentioned initially, that will be the correct one. Okay. അതുപോലെ ക്വസ്റ്റ്യൻ വായിക്കുമ്പോൾ ഷുഡ് ബി വെരി ക്ലിയർ ടു യു. അതുകൊണ്ടാണ് നമ്മൾ എന്ത് പറയുന്നത്? പ്ലീസ് അണ്ടർലൈൻ ദ കീവേഡ്സ്. സോ പ്രസൻസ്, മെഡിക്കൽ, പ്രോൺ. ഇസ് ഇറ്റ് സി? ഷുവർ ആണോ? വെരി ഗുഡ്. ഇറ്റ് ഈസ് ഫ്രം ബി. ഓക്കെ കൃഷ്ണ, എസീക്കിയൽ, ലിബി, ഷൈനി, ഇറ്റ് ഈസ് ഫ്രം ടെക്സ്റ്റ് ബി. ടെക്സ്റ്റ് ബി ആണ് കേട്ടോ. ഇറ്റ്സ് നോട്ട് ടെക്സ്റ്റ് സി, ടെക്സ്റ്റ് ബി. അഗൈൻ ടെക്സ്റ്റ് ബി. ആസ് യു ക്യാൻ സീ ഹിയർ ഇൻ ടെക്സ്റ്റ് ബി, certain medications, that is a keyword from the question, right? This includes a class of anti-anxiety drugs called selective serotonin uptake inhibitors. So answer is mentioned in text B. Okay, എന്തിനാണ് നമ്മൾ മെഡിക്കേഷൻസ് എടുക്കുന്നത്? What is the condition mentioned? Anti-anxiety. Okay, so answer is mentioned in text B. That is the correct answer. Then third one, അതുപോലെ തന്നെ more prone to എന്ന് പറയുമ്പോൾ text B is all about the risk factors of bruxism. Okay, so it is one of the risk factors is certain medication. So answer is from text B. Yes, very good, Krishna. Third one, which form of bruxism won't require medical intervention? So my keywords, form, then want, intervention. ഇപ്പം മെഡിസിൻ വേണ്ടാത്ത ഒരു എന്താ പറയുക type of bruxism ഏതാണ്? Where is it mentioned? If it is a short answer question, then what will be your answer? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? ഇതൊരു ഷോർട്ട് ആൻസർ ക്വസ്റ്റ്യൻ ആയിരുന്നെങ്കിൽ, if it is a short answer question, then let me know in the comment box what is your answer. Which form of bruxism won't require medical intervention? Yeah. Answer is in text A. Anale? Okay. So which type? So we have types of bruxism. Kanda. Randa type anu. First one is awake bruxism. Second one, sleep bruxism. Appo idile edanu? Which one doesn't need any medication? Medication vendathathu edha? Kanda. If you only brux during waking hours, you might not need treatment. Okay, so that is awake. Answer is mentioned in text A. Yes, very good, Jissa, Libby, awake. Then fourth one, the effective strategy to mitigate mental illness that might trigger bruxism. So effective strategy and mental illness. Yes. So where is mental illness mentioned? Where is the effective medicine or strategy mentioned for the mental illness? Yes. Okay, Nimmi, it is text A, third one. Very good, dear. Yes, Ezekiel, awake. Yeah. Okay, Krishna. Hi, Nimmi. Good afternoon. Okay. So fourth one. What about fourth one? Only Shiny got the correct answer, right? Very good, Shiny. Your answer is correct, which is from text D. Okay, where is it mentioned about the mental condition? Okay, so where is it mentioned? Medication for anxiety or stress. Kanda. Emotional issues, mental illness. So that means it is mentioned in text D. Then fifth one, the components that are used to make instruments that could manage bruxism. So my keywords, components, instruments, manage. Yeah. This is mentioned a little bit tricky, I know, but still, yeah. Components, instruments, manage. Where is it mentioned? Some things are used to manage this condition. Okay, Jissa, very good, dear. All right. Yes. Okay, Ezekiel, stress and emotion. Yeah, emotional issues. Okay, so fifth one, any answers? Question number 5. Components, instruments, manage. Very good, Krishna. Your answer is correct. Okay, yes, Shiny, Libby and Krishna. It is from text D. Where is it mentioned in text D? The components, splints and mouth guards. Okay, so these are designed to keep teeth separated to avoid the damage caused by clenching and grinding. They can be constructed of hard acrylic soft materials, components. So answer is from text D. Very good. Sixth one, consequences that may develop in the absence of timely management of bruxism. So my keywords, consequences, develop, absence. Yes. Okay, yes, Ezekiel. Very good, yes, correct or not? It's correct. Okay, sixth one is mentioned in, very good, Shiny. Answer is in text A. Okay, so where is it mentioned in text A? Consequences if it is not treated. See, left untreated, it can lead to sleep disorders, dental damage, then temporomandibular joint or TMJ disorder, then facial pain. Okay. Last one, seventh one, total number of patients considered for bruxism. A very simple question, total number patients. So, as you can see here, text C is all about the study. Okay, Petrana total number it is equal to 398. Okay. So that's mentioned in text C. Very good, yes. Okay, Libby, Jissa. Okay, Shopna, mentioned in text C. Okay, Amy, very good. So anyone with 7 out of 7? Anyone 7 out of 7? If you guys are getting 7 out of 7, then I'll be happy. Okay. Very good, Shiny. Already expected. Okay, Alfie. Okay, Jissa, very good, dear. Okay. Then 8 to 14, short answer questions. First one, what would be the most recommended treatment regime for the complicated cases of bruxism? Okay, short answer question on always remember maximum 3. What recommended regime? Regime, which means routine. So they are asking you regarding the most recommended treatment for the complicated cases of bruxism. So what is bruxism actually? Grinding of teeth. That's called bruxism. Knowingly, maybe unknowingly, you can do that. So knowingly if you're doing, because you guys are unknowingly it is when you are sleeping. Okay. So answer is dental correction. Very good. Okay, which is mentioned. The treatment strategy is mentioned in text D. And as you can see here, in the dental correction in severe cases when tooth wear has to lead to sensitivity or the inability to chew properly, your dentist may need to reshape the chewing surfaces of your teeth or use crowns to repair the damage. So answer is dental correction. Okay, so that is the correct answer. Okay, a lot of correct answers. Yes, Alfie, Nimmi, Ezekiel, Libby. Very good, very good. Okay, 7 out of 7. No, very good, Ezekiel. Okay, 9th one. Particular group of medications to which selective serotonin reuptake inhibitors are classified. And I've seen these words before, right? So group, medications, serotonin. Where is it mentioned? When we have read part B, I've seen these words here. Yeah. So certain medications, this include a class of anti-anxiety drugs called selective serotonin uptake inhibitors. A very direct answer. So answer is anti-anxiety drugs. And when you write that answer, you should write hyphen there because it is a hyphenated word. Okay, anti-anxiety drugs. And 10th one, okay, answer? Why? Yeah, 10th one. The drug that would be taken for a very less amount of time treat bruxism. So my keywords, drug, very less, and time. Yeah. Again, they are asking you regarding a particular drug. Or medicine. So what is the correct answer here? What medicine they are asking about? Okay, Jisa. Yes. Okay, Alfie, Libby, Ezekiel, Shiny, it's muscle relaxants, right? Okay. Relaxant alla, relaxants anale. Okay, muscle relaxants, which is mentioned again in text D, one of the medicine. Okay, muscle relaxants. In some cases, your doctor may suggest taking a muscle relaxant before bedtime for a short period of time. So answer is muscle relaxants. Okay. And okay, actually it's not relaxants, because in the question they are not asking what are the drugs. Medications alla choikkunnathu, what is the drug? Okay, so answer edumba namukku relaxants nu edam pattu? No. You can write it here. Endana? Muscle relaxant. I'm so sorry for my handwriting, okay, very bad. Yeah, I'm just removing. Yes, so muscle relaxant is the answer because it's not, the question is not about a plural question, it's all about what is the drug. So muscle relaxant. 11th one, total number of overseas candidates in the group. Okay, so total number overseas. Overseas, which means abroad, alle? Yeah. So total number 1. Very good. Answer is either 1 or you can write 1. Okay, which is from the study and it's here. Yes, living abroad, 1. Very simple one. 12th one, the overconsumption of which chemical found in coffee might increase chances of bruxism in people. So question is here. Question in the middle of the sentence. Which chemical? Coffee. Yeah. Which chemical? What chemical in coffee? Very good. It's caffeine. Okay, answer is caffeine. I hope the spelling is correct. Please do check. Okay, caffeine is the answer. Which is mentioned in text B. Yes. Caffeine is problematic. A lot of caffeine. So answer is caffeine. And 13th one, the type of bruxism that requires almost care and management. I'll read the answers, of course. Yes, Amy, Krishna, Alfie, Jissa, Asha, Shiny. Okay, Libby. Very good, very good. Nimmi, 9th question. Okay, Nimmi, on the forward, 9th question answer on the forward. I haven't seen your answer. Yeah, okay. So anyway, this is caffeine. 13th one, type of bruxism that requires almost care and management. So my keywords, type, care, management. Yes. Edana, 13th one. It is sleep. Okay. So type of bruxism, it is sleep. And you don't have to repeat that word again here. Endonda? Already bruxism is mentioned in the question. And when you answer it, sleep bruxism, see, don't repeat. Okay, so answer is sleep. Either type and it is separated. If sleep bruxism, if the word is a single word, sleep bruxism, then you can't separate the answer. But it is separated, sleep, space, bruxism. So answer is just sleep. Already bruxism is mentioned here. Okay. Yeah. Then 14th one. Which activity might have been done by the people if they are concentrating hard on something? So concentrating, activity, people. Yes. Very good, Libby. Answer is 𝐿𝐿 from text A. Ano? Yes. Answer is 𝐿𝐿 from text A. Ever I mentioned it? Yeah. It is 𝐿𝐿. It is mentioned in text A. Ano? Ade. It's not grind here. It is 𝐿𝐿. Okay, Krishna, it's not grind. 𝐿𝐿. Yes. Okay, Alfie. So grinding or cleansing, that's not starting the sleep bruxism. Okay, so answer is it's 𝐿𝐿. Yes. Okay. And answer I mark it so that you can get the answer. You might also notice your okay. Then okay, so that's the end of 14. Then 15th one. A form of dash may help some people with severe bruxism who don't respond to other treatments. So treatments, don't, and form. Form nanu parayunne, so definitely answer will be from text A. Ano? Ano? Text A le matra ano? Types mentioned cheyidekkunne? No. Already it is mentioned in text A as well as in text D also, right? Okay, answer endana? What about 15th one? 15th one answer enda? Severe form anengil what we are using. 15th question. What is the correct answer? A form of dash may help some people. This help cheyum nanu parayunne. Appo endana help cheyyunnathu? Severe bruxism. What is helping here? It is botulinum toxin. Okay, which is from here Botos injections a form of botulinum toxin. So that is the correct answer. It can help with severe bruxism. So answer is botulinum toxin. Then 16th one. Your doctor may recommend a short-term use of dash or what? Anti-anxiety medications to help you deal with stress or other emotional issues that may be causing your bruxism. So what is using here? Anti-anxiety allengil endha use cheyyunnathu? Same text alle. So anti-anxiety or antidepressants. Kanda, very direct answer. Antidepressants. Answer is antidepressants. Don't write it separately. Antidepressants it is a single word. Then 17th one. Grinding teeth can put extra strain on your teeth and jaws, leading to dental damage, dash, jaw pain and other issues. So what about question number 17? എന്താണ്? What is the missing word here? Very good, Amy. It's headache. Okay, answer is from text A. Okay, where is headache mentioned? It can put a lot of strain, teeth and jaws leading to dental damage, headaches, jaw pain. So headache is the correct answer. And the next one, 18th one. Among the patients who were considered for bruxism, dash of them got excluded due to ongoing medical condition or pregnancy. അപ്പോൾ ഇവിടെ pregnancy കാരണം exclude ചെയ്തേക്കുന്ന ആരെയാണ്? Excluded here because of pregnancy it is number is 4. 4 ആണ്. Very direct answer. And second last one, it's difficult to know exactly how many people grind their teeth because of it often happens during dash. എപ്പോഴാണ്? ഞാൻ നേരത്തെ പറഞ്ഞു knowingly or unknowingly you can do that. Unknowingly if you are എപ്പോഴാ? During sleep. Okay, during sleep, which is mentioned in here, kanda, because of sleep. And the last question, question number 20, you are more prone to bruxism if you have a depression or anxiety disorders like major depressive disorder, MDD, or dash. Where endum kuda undengilana, it is GAD, that is the abbreviation. Full form endha varya? What is the full form? Generalized anxiety disorder. Okay, so that's all about 20 set of questions. Anyone with 20 out of 20? Let me know in the comment box. And I think I'm muscle relaxants narikkum ningal edhikkunne, so it's wrong. So maybe 19, I guess. So whatever, that's it. So stay tuned. Okay, Alfie, very good year. Thank you.